Have you ever wondered how a homeopathic practitioner actually selects one specific remedy out of literally thousands of possibilities? I mean, from the outside looking in, it seems like a completely daunting, maybe even impossible task, right? But as it turns out, there's actually a highly structured methodology behind it all. So in today's explainer, we're going to decode that core mystery. We are going to look at exactly how a clinical homeopathic prescription is reasoned out, literally from start to finish. Welcome to the explainer. We're going to take a totally objective look into the internal logic, really the philosophical blueprint of a homeopathic prescription. We'll be drawing directly from pharmacy school curriculum materials, specifically looking at the organon of medicine and homeopathic philosophy to explore the strict set of principles that dictate how a practitioner gets from a generic diagnostic label all the way to a highly individualized remedy. Okay, so to do this, we're going to explore 4 foundational pillars step by step. First up is the law of similars, followed by individualization and totality, then the single remedy, and finally, we'll wrap up with the minimum dose. Let's just dive right into pillar number 1, the law of similars. This is really the absolute starting point of the entire homeopathic philosophy, and it's anchored by one big central question: what pattern matches? You know, the historical spark for this entire discipline came from a physician named Samuel Hahnemann. According to the source material, Hahnemann did this classic experiment on himself using cinchona bark, which, fun fact, is the natural source of quinine. When he ingested this bark while perfectly healthy, he actually developed intermittent fever symptoms that, amazingly, perfectly mimicked malaria. So he reasoned that cinchona treated malaria not through some arbitrary mechanism, but specifically because it had the power to produce those exact malaria-like symptoms in a healthy person. It's kind of like a giant puzzle. And that realization, it's a real game changer, illustrating the fundamental shift right at the heart of homeopathy. See, it moves the practitioner away from just asking, okay, what's the name of this disease? Instead, they are actively comparing 2 distinct pictures. On one side, you've got the disease picture. That's the full, unique constellation of symptoms expressed by the patient. And on the flip side, you have the medicine picture, which is the documented set of symptoms a specific remedy is known to produce. The whole goal is to make a reasoned comparison and find the absolute closest match between those 2 pictures. But here's the catch. To match these patterns effectively, you really have to know what you're looking for. A superficial match on a common symptom, like just having a general fever or a generic headache, is considered a super weak match. The true goal here is to match what they call a characteristic symptom. These are the peculiar, highly individualized expressions. Think of a fever, but it's accompanied by complete thirstlessness, or a symptom that gets way worse in a warm room but completely vanishes in open air. In this philosophy, those characteristic symptoms carry significantly more weight. Okay, let's ground this in a totally relatable example. Imagine a patient comes in with a head cold. Their eyes are watering profusely, but the tears don't burn. However, their nasal discharge is literally burning their upper lip. Now, if we ask ourselves what natural substance creates this exact peculiar pattern, well, the answer is probably sitting in your kitchen right now: raw red onions or allium cepa. Matching that specific patient pattern to the remedy allium cepa is basically demonstrating the law of similars, or like cures like, in direct, everyday action. And that perfectly transitions us over to the second pillar of our blueprint: individualization and totality. So if the first pillar was all about asking what pattern matches, this one is firmly anchored by the core question: whose totality is it? Within this specific framework, simply knowing a patient's medical diagnosis just isn't enough. Think about it for a second. 2 people could walk in with the exact same diagnosis, say eczema, or maybe a severe migraine, but they're going to experience that illness in entirely different ways, right? Individualization ensures the practitioner is treating the whole person as a unique organism, not just looking at some abstract diagnostic label. So how does that work in clinical practice? Well, this totality is built up systematically. Instead of just accepting a vague complaint like, oh, I have abdominal pain, a homeopath actually constructs a symptom using a precise 5-part formula. They look at the location, the sensation, the modality, which just means what makes it better or worse, any concomitant symptoms that are happening at the exact same time, and finally, the intensity. Let's look at a case study straight from the course materials to see this in action. Picture a student who gets a really severe headache after studying right under a blast of cold air conditioning. Her pain? It's a bursting sensation specifically in the right temple. It gets way worse from light and noise, but she actually feels better if she applies tight pressure to her head in a dark room. And here's the kicker, her mental state has completely changed. She's suddenly highly irritable and just wants to be left alone. In homeopathic case-taking, that irritability and that highly specific relief from tight pressure are ranked much, much higher than just the common fact that she has a headache. Once that complete totality is built, we arrive at the third pillar, the single remedy. This stage is entirely driven by the central question: which one medicine covers this totality best? Now, classical homeopathy strictly advocates for testing only one single variable at a time. And the rationale here is really all about clarity and solid methodology. Giving just a single remedy allows the practitioner to observe a really precise, dynamic cause and effect reaction without any confounding variables muddying the waters. It basically avoids the pitfalls of unproven mixtures, where, honestly, you wouldn't even know which component caused the patient to improve, or worse, have an adverse reaction. Sticking to one remedy makes patient follow-up highly systematic and incredibly accountable. And finally, we reach the fourth pillar. This one dictates how the medicine is actually delivered, and it's called the minimum dose. The guiding question we're asking here is, what is the least required stimulus? The source texts define this principle as using the absolute smallest possible medicinal stimulus required to trigger the body's self-healing vital response. It's important to note it's not just about giving as little as possible for arbitrary reasons. Actually, it's about carefully tailoring the potency and the quantity to the individual patient's unique sensitivity and their vitality. The ultimate goal is to evoke a curative response without accidentally causing any unwanted aggravation. So the absolutely crucial point here is the strict instruction of patience required by the practitioner. This is known as the least repetition rule, and the mandate is incredibly clear. Never, ever repeat a remedy while continuous improvement is taking place. Unnecessary repetition is viewed as highly disruptive. It can ruin a favorable therapeutic response, provoke those unwanted aggravations we just mentioned, or just completely obscure the clinical picture. Basically, if it ain't broke, don't fix it. Now, I think it is super important to ground all of these philosophical concepts back into a highly accountable, real-world clinical setting. The source materials strongly emphasize that these four principles do not just operate in a vacuum. They have to operate right alongside rigorous clinical safety and the absolute necessity for sound professional judgment. Because, as the texts make very, very clear, homeopathic philosophy does not somehow replace emergency care or a proper medical diagnosis. If severe red flags appear, and we're talking about things like severe dyspnea, totally unexplained weight loss, high persistent fevers with lethargy, or acute neurological deficits, the framework immediately mandates conventional medical assessment or an emergency referral, no exceptions. Patient safety absolutely always dictates the clinical boundaries. Okay, let's take a quick look at this summary matrix, because it brilliantly shows how all four of these pillars interlock to form one complete prescription blueprint. Similarity selects the remedy by asking what pattern matches. Totality individualizes it by asking whose totality is it. The single remedy principle tests and clarifies the choice by asking which one medicine covers best. And lastly, the minimum dose respects the patient's physiology by asking what is the least required stimulus. According to the texts, one principle without the others is just an incomplete prescription. The whole shebang has to work together. As we wrap up this explainer today, I really want to leave you with this fundamental question to think about. What is the true difference between treating a generic disease label and treating an individual's totally unique expression of illness? Understanding that distinction is literally the absolute key to understanding the entire homeopathic framework. It's a massive shift from standard categorization over to a meticulous, highly individualized approach to pattern matching. I really hope this deep dive into the source material has given you a clear, structured view of how this clinical reasoning actually works in practice.